Assalamualaikum everyone. My name is KAMILAH ILMI binti SYAMSUL ILMI. In this video, my friends and I will be presenting about halogens and vaccines. I will be explaining to you on halogens, and later in the video, my friend RABIATUL will do the explaining on vaccines. First of all, what are halogens? Halogens are non-metallic elements that reside in group 17 of the periodic table. The halogen group includes fluorine, chlorine, bromine, iodine, and astatine. It is actually quite easy to recognize them as they all end with the same suffix, which is I and E. Moreover, the term halogen actually originates from the Greek roots hal, that means salt, and gen, that means to produce. Therefore, the name halogen actually signifies that these elements have the ability to produce salts. For example, when halogens react with metals, they produce a variety of salts, including calcium fluoride, sodium chloride, silver bromide, and potassium iodide. Moving on, let me enlighten you on the uses of halogens. Actually, we use halogens in our life more often than we realize. An example would be our toothpaste. Our toothpaste actually contains fluoride, which is the ionic form of fluorine that strengthens our tooth enamel and prevents decaying of the tooth. Another quick example would be sodium chloride, or more familiar as table salt. Sodium chloride is the salt of sodium and chlorine ions. We use sodium chloride for our cooking every day as the ingredient that adds saltiness to our food. Last but not least, we have iodine. But for this one, I will let my friends further explain through a short sketch to help you understand the use of iodine in our life.
Umi, are you okay? I fell, Kamilah. Look at my hand.
Let's go and get your wounds clean.
Okay. Guys, stop. It's not safe to use that water. Why? Because...
Why can she clean her wound with that water? That water contains chlorine that can irritate the wound and delay the healing process. That water may also contain animal excrement-based bacteria like E. coli that can get into the blood vessels through the open wound. In addition, water and moisture can cause the skin to swell. Not only this can affect wound healing, but it can also increase the risk of bacterial intrusion and infection. Therefore, it is crucial to protect the wound from tap water. Why use iodine as an antiseptic to clean the wound? Iodine or povidone iodine is an antiseptic that is widely used to clean wounds. It is bactericidal against gram-positive and gram-negative organisms. Povidone iodine is an effective antiseptic that does not impede wound healing. This iodine also aids healing in a range of acute and chronic wounds. This iodine is safe to use for medical purposes because of its ability to penetrate against biofilms, has anti-inflammatory properties, low cytotoxicity, and has no negative effect on wound healing.
Assalamualaikum and hello everyone. Today we're going to talk about something incredibly important for our health. Vaccines. But what exactly is a vaccine? Let's dive in. Vaccine is a substance used to stimulate immunity to a particular infectious disease or pathogen, typically prepared from an inactivated or weakened form of the causative agent or from its constituent or products. When a person gets a vaccine, the immune system responds to the antigen as if it were exposed to the actual germ. It makes antibodies and remembers how to defeat it. Then, if the body gets exposed to the actual germ, the immune system can recognize it right away and quickly fight it off to prevent disease. In simpler terms, vaccines train our immune system to fight off specific germs without us having to get sick first. This makes them a powerful tool in preventing diseases and protecting public health. Vaccines have been responsible for the control, elimination, and its eradication of many infectious diseases. For example, smallpox was eradicated globally due to a successful vaccination campaign. So, by getting vaccinated, you not only protect yourself but also help protect our community by reducing the spread of infectious disease.
Hi ma'am, is there anything I can help you with today?
Good morning, doctor. My daughter has not been feeling so well these days. She has had fever and it reaches until 39 degrees Celsius. She even pukes sometimes for like a few times per day. And then she has not been pooping for 3 days. And she even cried like she's in absolute pain. Help me, doctor.
May I see your child health report card, please? I see that you've missed the polio vaccination for your baby since she was 2 months. And now she's 24 months old and still hasn't got her polio vaccination yet. Well, I understand your doubt about the polio virus vaccine, but here's the thing. Your baby has shown a few concerning symptoms of polio, and the most obvious one is the fever. She has a very bad fever, and it could lead to more complications. Your baby also vomited a few times today, like you said. Also, she might be crying because she feels extreme fatigue, and from what you told me, she has been experiencing constipation for a few days. These symptoms clearly show that your daughter is suffering from poliovirus. Unfortunately, there is no vaccine to cure the virus yet, but treatments will be done to help ensure your child's comfort and recovery. Actually, the vaccine is the main way to prevent polio. So you have missed too much appointment and your child is definitely at high risk and there's no turning back now. The only way you can help your child now is by letting us treat your daughter. And fright not, we will do our best. I highly suggest you allow your daughter to get the vaccine because some complications from the poliovirus are severe and can be undone if it's too late. I'm so sorry to see this, but if you still won't let your daughter have this vaccine, your daughter could possibly get a permanent paralysis of certain muscle groups, including the leg muscles or the muscles used for breathing. The malfunction of muscles used for breathing can cause death.
I stand with my decision, doctor. I'm not going to vaccine my daughter. Vaccine is a scam. I've heard cases of vaccine causing a child to develop autism. Hello?
Hello, is this RABIATUL mother?
Yes. Is there anything wrong?
Ma'am, your child, she is paralyzed.
What? My goodness, this is so painful. I can't reach my arms. For your information, polio is a very contagious disease caused by a virus that mainly affects the nerve in the spinal cord or brain stem. The virus is called poliovirus. This virus is a small non-enveloped RNA virus. Humans mostly receive the virus from contaminated water and food or through contact with feces-contaminated objects. Most children who are infected with poliovirus have no symptoms. However, a few have a mild symptom such as vomiting, sore throat, and stiffness. And this is why it is important for parents to make sure their children are always clean and have no contact with the affected feces. Not only that, but the poliovirus can also spread when an infected child cough or sneeze infected droplets from the air. As explained in the video, vaccine is one of the effective ways to prevent poliovirus. Based on Malaysia Society of Infectious Disease and Chemotherapy, there are two types of poliovirus vaccine that are currently in use. One is oral poliovirus vaccine (OPV), and another one is inactivated poliovirus vaccine (IPV). Since 2010, Malaysia have switched oral poliovirus vaccine (OPV) to inactivated poliovirus vaccine (IPV), according to National Immunization Program. This change due to the OPV-derived mutant viruses that are transmissible and cause an outbreak. Therefore, World Health Organization (WHO) recommends inactivated poliovirus vaccine (IPV) that contain the mixture of inactive strain of all three poliovirus types. There are three strains that are Mohaimu strain, MEF1 strain, and Southgate strain. This vaccine is not only for infants, it can also be used for children, adults, and even for breastfeeding mummies.